Astrocytoma is a type of brain tumor that develops from star-shaped cells called astrocytes. These tumors are graded from 1 to 4 based on their level of malignancy, with grade 4 being the most aggressive. In this comprehensive exploration of astrocytoma, we will delve into its characteristics, standard treatment options, prognosis at different stages, promising therapies, challenges, FDA-approved medications, risk factors, and available support resources. Understanding astrocytoma. Astrocytomas arise from astrocytes, glial cells in the brain and spinal cord that provide support and nutrition to nerve cells. These tumors can occur anywhere in the central nervous system, but are most commonly found in the brain. The World Health Organization, WHO, classifies astrocytomas into 4 grades. Grade 1. Pilocytic astrocytoma is a low-grade tumor that is usually benign. It tends to occur in children and young adults and often has a favorable prognosis. Grade 2. Low-grade astrocytomas are slightly more aggressive than grade 1 tumors but are still considered slow-growing. Grade 3. Anaplastic astrocytomas are high-grade tumors with more aggressive growth characteristics. Grade 4 is termed glioblastoma multiforme, GBM, is the most malignant and aggressive form of astrocytoma. Standard of care treatments. The treatment approach for astrocytoma depends on several factors, including the tumor grade, location, and the patient's overall health. Standard treatments include surgery. Whenever possible, surgery is the primary treatment. Surgeons aim to remove as much of the tumor as safely achievable without causing damage to critical brain structures. Occasionally, radioactive grains are left in the surgical bed to reduce the risk of cancer recurrence. This is called brachytherapy. One promising form of brachytherapy is called gammaTile. Radiation therapy. Radiation therapy is typically used after surgery to target remaining cancer cells and reduce the risk of recurrence. Chemotherapy. Chemotherapy may be administered before or after surgery, often in combination with radiation therapy. Temozolomide is a commonly used chemotherapy drug for astrocytoma. Targeted therapies. Targeted therapies, such as bevacizumab, Avastin, may be used for GBM to block the formation of new blood vessels that tumors need to grow. Sometimes, a brain tumor may have a genetic mutation, such as a BRAF mutation, allowing for the use of a medication such as dabrafenib. Clinical trials. Participation in clinical trials may offer access to novel treatments and therapies under investigation. One website to research clinical trials for astrocytoma is enclive.com.laser interstitial thermal therapy, LIT. Laser interstitial thermal therapy, LIT, also known as laser ablation or laser thermotherapy, is an emerging minimally invasive treatment option that has shown promise in the management of certain types of brain tumors, including astrocytomas. LIT involves the use of laser energy delivered through a thin, flexible fiber optic probe that is precisely guided to the tumor site within the brain. The laser generates localized heat, which is used to thermally destroy or ablate the tumor tissue. LIT is particularly relevant for treating astrocytomas when they are localized and accessible. It is most commonly considered for low to intermediate grade astrocytomas and focal or recurrent high-grade astrocytomas, for example, glioblastoma multiforme or GBM. LIT offers several potential benefits, including shorter hospital stays, quicker recovery times, reduced post-operative pain, and the possibility of improved quality of life for patients. It may also be considered for patients who are not candidates for traditional surgery due to factors such as tumor location or patient health. LIT is offered at many leading brain surgery centers such as Duke University. Prognosis. The prognosis for astrocytoma varies significantly depending on the grade and stage. Grade 1, pilocytic astrocytomas often have an excellent prognosis, with long-term survival rates exceeding 90%. Grade 2, low-grade astrocytomas have a moderately favorable prognosis, but they can be challenging to fully treat and recurrence is possible. Grade 3, anaplastic astrocytomas have a less favorable prognosis with a median survival of several years. Grade 4, GBM. Glioblastoma multiforme is the most aggressive and challenging to treat. Despite aggressive treatment, median survival is often measured in months. Promising therapeutics research into astrocytoma. Therapeutics is ongoing. Several promising avenues include immunotherapy. Immunotherapies, such as checkpoint inhibitors, are under investigation for their potential to enhance the body's immune response against astrocytoma cells. Targeted therapies. Researchers are exploring drugs that target specific molecular pathways involved in the growth of astrocytoma cells. Multi-pronged attack. Due to the aggressive and dangerous nature of brain tumors, and because it is difficult to get medication to pass through the blood-brain barrier, many of the most successful human trials against brain cancer involve several therapeutics. One example is the QST 9v3 trial, which involved administering 9 FDA-approved drugs off-label to recurrent GBM patients. The overall survival was far longer than expected, with minimal side effects. The book Cancer Self-Defense 101 Quick Tips to Help You Survive describes many human trials that have had success with integrative treatments against brain cancer. Challenges and complexity. Astrocytoma presents several challenges. Infiltrative growth. Astrocytomas often infiltrate surrounding brain tissue, making complete surgical removal difficult. GBM aggressiveness. Glioblastoma multiforme is highly aggressive and resistant to many treatments. Limited treatment options. Treatment options for high-grade astrocytomas, especially GBM, are limited, and outcomes can be poor. Risk factors. The exact causes of astrocytoma are not well understood, and there are no definitive risk factors. However, some potential associations include radiation exposure. Previous radiation therapy to the head for other medical conditions may slightly increase the risk. Genetics. Certain genetic conditions, such as neurofibromatosis type 1, NF1, and Li-Fraumeni syndrome, are associated with a higher risk of brain tumors, including astrocytoma. Support resources. Coping with astrocytoma can be challenging, and individuals and their families often benefit from support resources. American Brain Tumor Association, ABTA, provides information, support, and resources for brain tumor patients and their families. National Brain Tumor Society, NBTS, offers patient and caregiver support, educational resources, and advocacy for brain tumor research. Cancer Support Community provides emotional support, counseling, and community for cancer patients and their families. For more information, please see the book Cancer Self-Defense 101 Quick Tips to Help You Survive.